and it says subscribe for updates. That's a great way if there is a particular page that you are particularly interested in, be it our Olmstead plan, be it quality updates, be it the one that my favorite, our public comment page. Go ahead and subscribe for updates. You'll get a friendly email from DHHS every time we change or make an edit to that page, which is a great way to keep yourself informed of all the latest and greatest happening in our division. So now, just to go over some general Medicaid and HCBS waiver information. Medicaid overall is a public health insurance program which provides health care services to qualifying individuals. Within Medicaid, we have folks kind of in 5 different categories here in Nebraska. We have low-income adults, pregnant women, children, older adults, and people with disabilities. The primary goal of Medicaid is to provide those healthcare services to low-income people and families. So Medicaid, when we talk about Medicaid, those are just the health-related services. Medicaid, to qualify for Medicaid, there's a couple of different ways that we see people applying for Medicaid. One is as a child. When an individual applies as a child, they will look at the family income and resources. And that's always the first way that we look at children's eligibility. Is the entire family eligible based on a parent's income? For those lower income families, we do see individuals that are qualifying just based on their income. The child, as well as the entire family, may need Medicaid to provide that those health services. We also, though, have individuals who are applying, but the family's income exceeds that which would normally be eligible for Medicaid. They're over income. And when a child or the family is over income, that's when we refer the child and refer that application to the Katie Beckett program. The Katie Beckett program is a specialized program that is a mechanism for us to be able to disregard parents' income. So when we have a child that is potentially eligible for Katie Beckett, that child must be at the institutional level of care. Because Medicaid is primarily concerned with providing those medical services, one of the things that we use in waiver land are these different levels of care to say that an individual would normally qualify, or a child would normally qualify to live in a hospital, a nursing facility, or an ICF, an institution like BSDC. If the child is eligible to live, meets that level of care, it would be eligible based on their care needs to live in a hospital, a nursing facility, or an ICF, and is disabled, then we are able to look at that child's income and resources alone and apart from their parents' income. And we see a lot of children, especially with a family support waiver, that are accessing our waiver through this Katie Beckett program by having their parents' income disregarded when we look at their Medicaid eligibility. When this happens, we then bring the child alone and apart from the parents into Medicaid. And then from Medicaid, they are able to either stay just with Medicaid, maybe the Medicaid supports and services, that secondary insurance was all that they were really interested in, or they can use that as a basis for then being able to also be eligible for one of our waivers. Additionally, individuals can apply as an adult at age 19. They are considered an adult. Therefore, only their income will be looked at. Parental income is no longer considered at age 19, regardless of where the individual lives. And so generally speaking, individuals who may be eligible for our waivers are able to qualify on their income alone, because many of our individuals that are looking at aged and disabled or one of our ICF level of care waivers aren't otherwise in jobs that would make them not income eligible. So as I was talking about the Katie Beckett program, I made a mention of the fact that individuals would need to be disabled as well as qualifying for that level of care. So Medicaid disability is is the same as a Social Security disability. For those of you who may know that you've applied for Social Security and gotten that designation, same thing when we look at a Medicaid disability. A disability determination is needed and can be used to qualify for our aged and disabled waiver when an individual is not yet 65, or can be used to qualify for the Katie Beckett program. Those are the two applications that we see in our programs of the SSI or Medicaid disability. Because we recognize that working with Social Security is at times cumbersome, we have within the state of Nebraska the state review team. The state review team is meant to be a bit of a safeguard to that Social Security Administration, understanding that they at times work more slowly. And the state review team applies the same criteria that the Social Security Administration applies and looks at that individual and can make the equivalent decision to what SSI would determine, oftentimes more quickly than what the Social Security Administration is able to do. So the SRT determines if a person meets disability criteria. Upon receiving 12 months of medical records, they need those 12 months of medical records. And it is important for the SRT team to look directly at the medical record. For the SRT team, there is a massive distinction between a letter or a report that says a child has a disability, an IEP, an MDT record, something like that, that says, yes, this child is disabled and these are the services, the supports that they need, is different from actually seeing the test result that says we gave this test on this day and there were these deficiencies and this was the fact of the matter, and this is how we came to the decision that this child was disabled. It's really important for the SRT team to see the actual medical documentation. So as you're thinking about or looking forward to an SRT review, pulling together that direct medical documentation is really important because we can't just base it off of letters from doctors or letters from the schools or other places. It's a little bit different than other parts of our qualification process. So an individual can use the SRT or an SSI determination to qualify for our waivers or the Katie Beckett program. It is important that individuals who are applying to our waiver do apply to SSI. That's going to be a critical piece for them down the road. But the SRT team can be a shortcut to getting that same determination a little bit quicker if they need it for waiver eligibility. When they receive that SSI disability determination, though, that does make them eligible for monthly payments to those adults who have the qualifying condition.
Colin, we do have a couple of questions as far as the
Yes, ma'am.
application. So one came in and it said, I have a family that was told to apply for Medicaid and the A&D waiver, but to put Katie Beckett in every blank space. Is that correct?
That's really good advice. DHHS has launched a new waiver, or not a new waiver, sorry, has launched a new Medicaid application process called iServe. It is phenomenal. It is worlds better than the old Access Nebraska page that folks were used to working with. That said, there is a limitation within our process that Katie Beckett is only applicable to a small number of individuals. And so it's not a part of the kind of regular Medicaid review. And so what we have told people to do is, one, we will admit that the Medicaid eligibility worker should be noticing that there is a disabled child within the family, and based on that alone, sending it over to Katie Beckett. But we also recognize that people and processes are imperfect. And so putting that, I'm also interested in Katie Beckett as another kind of sign and road marker that's flashing neon to alert that eligibility worker that, hey, there's something here and I should send it over to Katie Beckett, is really good advice. They're always able to follow up with that eligibility worker. They are always able to appeal a decision, but it's much easier for us if it's just caught there the first time and we can immediately send it over, because it's easier for us, it's easier for the family. So that's really good advice, to just note that you're looking for Katie Beckett when you apply.
Okay. And another one is if an individual has an SSI determination of permanent disability, why would that individual need to go through the SRT every few years?
They should not. If they have been found to be disabled by the Social Security Administration, then they should never be referred to SRT. So
Okay.
if they are, by all means, let your eligibility worker know, let your service coordinator know, make sure that Social Security disability determination is noted. They should be seeing that. But because SSI or because SRT is a stand-in for the SSI determination, it's easier on everybody's part if we just rely on that SSI determination and waive them on past the SRT review.
Okay. And then there was another question on how do you get assessed by the state review team? Do you apply on iServe or is it somehow flagged in iServe?
That's going to be something that will be flagged internally because they'll see that an individual um, what's going to happen is they're going to review the application. They're going to say, okay, based on what's been submitted, the family is over income. That would result in a denial. But we see that there's a child with a disability here that's been identified in the application. And so then we're going to send it over to our Katie Beckett program. And the Katie Beckett program is then going to take a look at that application and say, okay, we need a couple of things here in order to find an individual eligible through the Katie Beckett program. The first thing and perhaps easiest thing is we need to complete that level of care. And they'll get out there, they'll complete the level of care. And the eligibility worker will come back and say, yeah, this individual, they meet our nursing facility level of care. Or they'll come back and say, nope, that individual meets our ICF level of care. That point, we have the level of care met. And then we're going to take a look at the file and we're going to say, well, in order to access this program, we need one more step. We need that disability determination. And they'll look at our Medicaid records and a program called InFocus and see, is that disability determination noted in the individual's file? And if the disability determination is noted, then wham bam, welcome to the program. It's great to have you here and we'll get you connected with services. If that disability determination is not noted there in the file, then that's when they'll send it over to the SRT team, and the SRT team will reach out and say, hey, we don't see a disability determination from Social Security. We're going to need to collect some information so that we can make a determination to go ahead and get you the eligibility that you're looking for. And so it's all handled internally with our Medicaid eligibility, our Katie Beckett team, and our SRT team working in partnership to make sure that all of the boxes are checked and the individuals get the eligibility that they're eligible for.
Okay, we've had a couple more roll in here. Somebody asked, what time frame would you recommend people apply for that SSI benefit when so many individuals will not become income eligible until 18?
So applying early is always the best case. These are at times longer processes, and applying early, it never hurt anyone. So whether it's applying to be on our family support waiver, even when your needs are small, so that you are in the system and that you have a service coordinator and you have those services and supports, that's great. Do that early. If you're looking at the SSI determination and knowing that you will need that, apply early. The worst case is that SSI says not right now, come back later. And that's where we have the SRT team that can continue those reviews for you. In the meantime, if that's the case. But it's always important to just apply early because these can be longer processes. And we want to make sure that folks have provided ample time for themselves to allow all of the reviews to occur.
Okay. There have been people with Down syndrome who are denied Medicaid. I thought that I'd heard that if the individual has a disability, the child would be eligible from Katie Beckett. Is this correct?
So a couple of challenges that we have. One is if an individual doesn't, we do have individuals that don't qualify using our level of care. It's not to say that they are not disabled. They may have very real disabilities, but they don't meet that institutional level of care. And that will limit their ability to access the Katie Beckett program and access our waivers. We also have individuals that, while they might meet our level of care, this is fewer instances, but some still, they meet our level of care, but the guidelines that the federal government has set for what qualifies as a disability is a high bar, and they don't meet that federal definition of what a qualifying disability is. Again, this isn't to say that they don't have very real disabilities and challenges that they're working through, but they don't meet the federal requirements for what a disability is. And our SRT team is required to uphold those federal standards. We're not allowed to set a Nebraska version of disability. We have to apply the exact same standards as Social Security. And so we do see some individuals that may qualify for our level of care, but the disability isn't found to be a likely lifelong disability that's eligible and qualifying by SSI. So there are individuals that unfortunately just don't qualify for Medicaid or our waivers. Thankfully, that is where we have our special healthcare programs within the division to allow for that warm handoff, because an individual who may not be eligible for one of our waivers or for Medicaid may still be eligible for a program like Lifespan Respite or Medically Handicapped Children's Program or the Disabled Persons DPFS program. We have other programs out there, and we will work to make sure that an individual is aware of any and all programs that they may qualify for, especially if they are found ineligible for one of our Medicaid, either our Medicaid program or a Medicaid waiver.
Okay. Does a school psychologist diagnosis of an intellectual disability qualify as a determination, or does there need to be a medical diagnosis?
That would be one that I would need to check with our SRT team on, and can let you know, Jennifer, so that you can follow up with whoever asked the question afterwards.
Okay, thank you. That's all for now.
All right. So once we have that eligibility for Medicaid that we've gotten through our SRT process, then the next one is looking at our HCBS waivers. The HCBS waivers, or home and community-based services waivers, allow the state to waive certain Medicaid requirements, like being served in an institution, to avoid that institutionalization. When you are using a waiver, you are waiving your right to institutional care. Under Medicaid, you would be entitled to be served in a nursing facility, which is paid for by Medicaid. You would be entitled to be served at an ICF like BSDC that is paid for by Medicaid. You would be entitled to, we don't have a hospital level of care, so I won't go into that one. But you would be entitled to be served in an institution, and you are waiving your right to that institutional care in order to be served in your home and in your community. So that's what the waiver is. So waiver services are then in addition to straight Medicaid services. Medicaid will pay for the medical services and supports. We pay for the non-medical services and supports. Waiver providers are, though, paid by Medicaid for services. So all of our providers are also Medicaid providers, and they are designed, those services are designed to help people live successfully within their communities with as much independence as possible. Waiver services are paid to wrap around natural supports, though, in order to meet a person's need. That is one of the core pieces, is that we need to wrap around those natural supports and not necessarily replace the natural supports. So service examples within our waivers is help with teaching household tasks, home and vehicle modifications, respite care, access to a emergency response system, or to assistive technology, the technology that enables us to do those ADL and IADL tasks, as well as teaching skills in order to get or maintain employment. This is an area of significant interest for us as a division, is growing the number of individuals who are accessing competitive integrated employment within our waivers. Participants, though, also use services from other DHHS programs, from the Department of Education, from Department of the Department of Education, and then vocational rehabilitation within the Department of Education. And our services cannot be duplicative. So if an individual is entitled to services through, for example, their public school district, waiver can't replace those services. If an individual is entitled to services through vocational rehabilitation, we're not allowed to supplant those services. So it is important that our waiver services are what we would like to say is the payer of last resort. Here in Nebraska, we do have 5 HCBS waivers. We have 2 at the nursing facility level of care, our aged and disabled waiver. This serves individuals birth to death who are either aged, 65 plus, or disabled. We also have our traumatic brain injury for those individuals that have had a traumatic brain injury, and there's a definition for what that traumatic brain injury diagnosis looks like. And then we have our 3 ICF waivers for individuals with developmental disabilities. We have our family support waiver supporting individuals 0 to 21. And then our day waiver, or DDAD waiver, serving individuals 21 to death. And our comprehensive waiver, which provides the highest level of services for those most in need, that serves individuals birth to death. It is important to note that an individual may only receive services from one waiver at a time. So what do the eligibility requirements look like? To be eligible to receive any of the HCBS waivers, a person must first and foremost be eligible for Medicaid. That's the first step of the process. To be eligible for Medicaid, in addition to the qualifications that we've talked about through SRT or income, an individual must also be a citizen or legal resident of the United States and be a legal resident of the state of Nebraska. Next, we'll look at that level of care requirement, either the nursing facility level of care or the ICF level of care or intermediate care facility. And then lastly, we have that need for waiver services. We'll need a person-centered plan, and we'll need to work with a service coordinator in order to identify the appropriate services and supports that individual has.
We've had another couple questions roll in. If
Yes,
you are ready to take a little breather while I read them to you.
sure.
Okay. One of the questions was kind of going back a little bit. The special healthcare programs that you had mentioned,
Mm-hmm.
are for families that did not meet eligibility and are over income. Are there options for these families, or where would you direct them if they're over income?
For the waiver
No, for
programs.
the other programs, like you said, if they don't meet the level of care, and then their additional programs, medically handicapped children's program, um, if they're income based and the families are over income, are there other options?
That would be where we would that would really be for us a conversation we would need to have with that family about what, where all of our programs within DHHS use different income guidelines. And so we would be looking at what the family's income was, to identify if there was a program that could be supportive. Also looking at what the family's need is and what programs might be supportive of that need. We don't want to connect them with a program that's going to, we've had some families who have been able to pursue not vehicle modifications, home modifications through a U.S. Department of Agriculture program because they live on a piece of agricultural property and that's what they happen to need. That said, if an individual is interested in respite, that Department of Ag home modification program is not going to be of much help to them. So we'll really need to work with them on an individual basis to identify what program, and what the kind of constraints that they're working with are, to see if there is a program that's available for them.
Okay. How does a caregiver know which waiver program is best for them to apply for? Or should they just apply for them all and hope for the best?
Um, that is a conversation that they should be having with that eligibility worker. When they fill out that application, they can mark all the options there, that they think they're qualified for. I would say if the individual hasn't had a TBI, maybe not applying for the TBI waiver. But otherwise, applying for the programs that the family thinks that they are qualified for, AD and DD. That eligibility worker, when they get that application, will probably reach out to the family and is able to have a conversation with the family about these are the differences and similarities between the waiver. Of course, an individual is always able to apply for all of the programs that they wish to, but that eligibility worker can help them to think about what kinds of services and supports are they interested in, and then which waiver is best going to support those needs. So, for example, if an individual is interested in a host of services that can support them in their home, but they also have a goal or an interest in competitive employment, vocational rehabilitation, and those kind of skill building for a job may be of interest to them, then that eligibility worker is going to say, well, on the AD waiver, that's not available. We really need to be focusing on the DD waiver because that's where those services are available. Or if an individual is looking at some sort of out-of-home residential need because that's what their needs are, again, the eligibility worker may say, well, that's not available really, except for kind of an assisted living facility type of service on the AD waiver. The DD waivers are going to be better for that. And the eligibility worker can help them to understand what the kind of the upsides and downsides of each of our waivers is.
Okay, and then this question, how does a family get connected with an eligibility coordinator if they did not qualify for waiver service coordination? I don't know if that means if they have questions on why they weren't eligible or.
Yeah, to get in touch with our eligibility team, that's really going to be submitting the application. Then the eligibility team member will reach out and answer questions. If they already have a relationship with the service coordinator, they can talk to the service coordinator as well. But that service coordinator is really there to support individuals to access the appropriate service of those that they qualify for and to help kind of navigate that system once they're on the inside. But the eligibility worker there can help provide that guidance between services. On our website, there is a link that families can request a meeting with someone from the division. If a family is really not sure what might be appropriate or what they may best be served with, they can request one of those meetings. And we'll set something up with somebody from our team to talk them through that. We'd also encourage you to talk to our PRCs. They are a wealth of information and can talk to families about their unique situation, what exactly the needs are for the family or for the participant, and then what waiver may best meet their needs or program may best meet their needs, depending on what they're looking for.
Thank you.
Yeah. So first, we'll talk a little bit about the nursing facility level of care waivers. So this is our age and disabled waiver and our TBI waiver. The AD waiver is those for individuals who are aged 65 or older or disabled. This is where the SSI determination or the SRT determination becomes critical for our aged and disabled waivers. We also have the TBI waiver. Those individuals have to be 18 plus, disabled within that same criteria, either by SSI or SRT. Yeah. And then have a diagnosis of a traumatic brain injury. And you'll see the definition there for what a traumatic brain injury is within Nebraska there on the slide. This program, it is important to note, is not for acquired brain injuries. This is a question that we get from time to time, and we certainly worked through in our last renewal of the TBI waiver. The traumatic brain injury waiver within state law is designed only for traumatic brain injuries and not for acquired brain injuries. We do have some individuals, depending on when that brain injury occurs, that may, with a traumatic brain injury, qualify for one of our developmental disabilities waivers or potentially for our AD waiver. But that traumatic brain injury waiver is limited to only those individuals with a traumatic brain injury. So for these two waivers, we look at the nursing facility level of care. We use the NRI assessments and have for a number of years for our nursing facility level of care. An individual generally receives an NRI assessment per year, and which assessment they use is based on age. We have one assessment for adults, another for children. And that nursing facility level of care is going to look at a number of things, including medical conditions, treatments, risk factors, cognitive factors, and ADLs. This is an example of the services available on the AD waiver and the TBI waiver. We, in our last TBI renewal, worked to expand the number of services that are available. And the differentiating factor really between the AD services and the TBI services is the inclusion of the supported employment services on the TBI waiver. There's also specialized training required for providers on the TBI waiver to best support individuals who have a TBI. We do have quick guides, and you see the links for them when Jennifer sends out the materials after the presentation. All of these links will be live, and you'll be able to click on those to get the quick guides so that you can see more about what services are available on either of these waivers. Next is the DD waivers. These are waivers that are assigned or tied to an ICF level of care or intermediate care facility level of care. And these is the family support, the developmental day, and the comprehensive waiver. There's 3 of them. The family support serves birth through 21 and is designed to support both the child and their family. The day waiver serves those individuals 21 and older and really is designed to replace the services and supports provided by the school system, which is why individuals receive an offer from that day waiver oftentimes when they graduate at 21 from the school system. It's really designed to maximize independence in the community and support residential living, often independent living, either with their natural family or on their own. It also has a focus on competitive integrated employment. Lastly, we have our comprehensive waiver. It serves all individuals. It's again designed to maximize independence and help people to socialize within their community, and does, as a differentiating factor from our day waiver, includes that access to 24-hour residential services, something like a group home or a shared living provider. One of the biggest differentiations between the DD waivers and our AD waivers is that the DD waivers is a habilitative waiver. It is a teaching waiver, whereas our nursing facility level of care waivers are rehabilitative, and they're not focused on those teaching skills. They're focused on really just supporting the individual where they're at. And that's one of the things, as you asked earlier about, which waiver might be right for my individual or for myself. And that's a piece that we talk to families a lot about is this individual someone who we just need to meet where they're at, but there's not a habilitative goal? Or is this a person that we really want to build skills and develop across their lifespan? Because we know that they are capable every day of doing more. The DD waivers are those habilitative waivers, whereas the AD waiver doesn't have those habilitative teaching elements to it in the same way that our DD waiver does. How do we define developmental disability? It is defined in statute. Diagnosis before age 22, expected to continue indefinitely, and must have substantial functional limitations in 3 areas: conceptual, social, and practical. The kind of definitions there are on the screen for you. It is important to note that an individual under Nebraska state law must have deficits in all 3 areas. We do at times see, I think this part of this question kind of came up earlier. What happens? Some people aren't found eligible, but they may definitely have a developmental disability. It may be because they don't have limitations in all 3 conceptual, social, and practical skills. That is a part of state law. And when we review individuals and do our statutory determination as to whether they are eligible under state law for one of our DD waivers, this is one of the things that we look at. And so it is important to note that an individual has to have limitations in all 3 of those areas. That is different from other states. Some states have more areas, some states have less areas. Nebraska, 3 areas.
We do have lots of questions rolling in if you want me to break
All
in, or
right,
would you
we
like
might
to
as
wait?
well take them now.
Okay. So on the acceptance of a waiver, if you what is the time frame for a family to accept a waiver once they receive the offer letter? such as if a family has not heard back from one waiver, like they applied for the A&D, before they receive an offer for the family support waiver.
Um, so if they are looking at having multiple waivers, that's something where they just need to be, I would encourage them to be in touch with their eligibility worker. I would have to look at the letter to see if there is any noted, timeline on there. But that's something that reaching out to your eligibility worker, letting them know kind of what does it look like? This is why we're waiting on getting you an answer back. Just so that everybody's aware and we can work to support the family through that. That said, the sooner that a family accepts a waiver offer, the sooner we can get them referred over to service coordination and started on waiver services. So responding within 30 days would always be helpful. The sooner they respond, the sooner they respond, the sooner we're able to connect them to those waiver services.
Okay. We have actually gotten two questions that kind of mirror each other. So I'm going to try and make this make sense. But what if you are on one waiver, we'll say the A&D waiver, and you apply for the comp waiver and qualify? Can you switch back to the AD waiver if you would like to and it suits your needs better?
Yes and no. The waivers are not set up so that an individual is able to jump from one waiver month to month, because on days that end in Y, the AD waiver is better for me than the DD waiver. That said, we understand that there are changes of need. And when there is a change of need that can be documented over time, then we are able to have the individual reach out to their service with their assigned service coordinator. They can request a change of need. We may be able to update their current waiver program to better meet their needs at that point. We may also, though, need to conduct a new NRI assessment, either for their current waiver or for a new waiver. But these are two different levels of care. And that if it was going to be some sort of mid-year change, would be something that we would really be looking for a demonstrated change in condition to warrant moving from one waiver to another mid-year. The annual is the perfect time to make that determination, though, or make that change. If an individual is approaching the end of their waiver year and the WSS has reached back out to schedule a new NRI, a new level of care, that would be a great time to say, hey, I know that you've just reached out to me for my NF level of care for the AD waiver. I'm actually more interested at this point, and I think it would better meet my needs to instead be served on the DD waivers. And that WSS will be able to then come out, can answer any questions that you might have, but then can come out and do the ICF level of care in order to get you qualified for that different waiver.
And Colin, if I could maybe just add a little bit, can you guys hear me
definitely,
okay?
Jill.
Give you a chance to take a breather for a second. I really appreciated Colin's note about connecting with the assigned service coordinator. And sometimes, when families are thinking that maybe they want to go back to the other waiver either side, being able to maybe have that service coordinator reach out with another SC in that local area on the other waiver, and just having a joint call and better understanding like what specifically is it you were looking for on the other waiver. Did anything change with that? It turns out we have something similar on this waiver. And sometimes just by having and bringing, if you're currently on the AD waiver, bringing a DD waiver expert to the table and having an open dialogue or vice versa can also be very helpful. We would much rather have that conversation with you up front and kind of talk about why you're thinking about wanting to switch back or to even just apply for the other one, than have you go through all of that work to apply or to switch to get there and realize turns out you were, the service that you were using was what you needed. So just have that current service coordinator that you have reach out and try to have somebody that's an expert on the other waiver maybe come and join a conversation with you guys. That could be really helpful.
Okay. Lots of questions coming in. if an individual was approved for the Katie Beckett or the family support waiver, how could they get onto a waiver for residential funding?
So if an individual is currently being served, I'll take Katie Beckett to think that perhaps they are only on the Medicaid program. They're currently not in a waiver. The first step's going to be applying, getting on iServe and submitting a new application for one of our waivers. That'll get that ball rolling with the WSS to get them out there, do whatever kind of statutory eligibility determination that we need to make sure the individual is eligible for our waivers, to complete the level of care if the one is not current, and getting them moving through that eligibility process for our waiver would be step one if an individual is currently only accessing Medicaid. If they're accessing the family support waiver, so they have Medicaid and family support waiver, then that's where we would be looking at that change of need, a conversation with the service coordinator to say, here's what we have and here's the gap that we're experiencing, and talking with them, and the service coordinator can then support them in making that application to the comp waiver, if that's appropriate to better meet the individual's needs.
Okay.
Jill?
Yeah, I was just going to chime in. And so yearly we'll be conducting, and I think that's in a couple of slides here that Colin will talk about, the NRI. And yearly at the time of the level of care, that's also an opportunity when we'll be doing that NRI assessment, and it'll have a chance to look at that person's skill and abilities and needs for that year. Perhaps that does trigger a different waiver at that time to allow the opportunity for some more services. And we're excited that we're going to be doing that really yearly in real time to be able to make that adjustment if necessary. And Colin speaks to the change in need process, and that is the process that service coordination follows outside of that yearly annual level of care. And there are some prompted questions that service coordination will ask teams, what's that increase in need, or what's that change in behavior or change in medical? And we really have to have the supported documentation to support that change in need request to get that NRI done in the mid-year. And it might make a little bit more sense when we get a little bit into some of those slides as well.
Okay. I had heard that there's a limited time frame of when, I'm guessing they're meaning the comp waiver, but it says DD waivers applications are taken. Is that accurate?
No. One of the individuals can apply at any time. And with the elimination of the wait list, Nebraska is able to provide the services and supports that an individual requires at the time of application. And that is one of the really important differences between the way that we had been operating our DD waivers and the way that we're able to operate them today. So when an individual applies and qualifies for the comprehensive waiver or the family support waiver, we are able to immediately connect them to a waiver slot and get them those services and supports that they need. There's not a waiting list for the family support waiver. There's not a waiting list for the comp waiver. As soon as an individual applies and it's just a general DD waiver. It's not, I apply for comp or I apply for day or I apply for family support. They're just going to apply for our DD waivers. That NRI then is going to assess their needs, and they'll get an eligibility determination based on the waiver that is going to be most appropriate for the needs that they have.
Okay, let's see. How long are you waiver eligible for?
So our eligibility for waiver is an annual process. An individual is going to be reassessed on an annual basis to ensure that they continue to qualify for Medicaid, to ensure that they continue to meet the level of care. That was the annual NRI process that Jill talked about. And to ensure that the services and supports that they're receiving are still the right services and supports to meet their needs.
Okay. we still have more questions coming in. I don't know if you want to continue with a few more slides
Yeah,
and
let's
then,
get through this
okay,
section, then maybe we can pause again and
okay.
see if there's others that haven't been addressed. So helpful things in applying for that DD eligibility. Again, it's just going to be a single, I'm applying for a DD waiver, and then the eligibility team through that NRI will slot an individual to the waivers that they're eligible for. But things that can help speed the process, providing any medical records from a diagnosing doctor, assessments from a licensed psychologist, and there'll be a link here that'll come through in the presentation that you'll be able to look more at the information that we have there. Information from the schools, whether that's an MDT report or an IEP. And the sooner you get this information to us, the more information that you're able to get to us, the easier time we are going to have, our eligibility team is going to have in reviewing and finding the individual eligible for services. If we receive an application without any documentation, of course, our team will reach out and say, here's the documentation that we're interested in. Can you please send this back to us as soon as you can? But if you're able to upload that documentation and send it right along with your application, it just cuts that step out of the process. We are then out on an annual basis for both when an individual first applies and then annually thereafter to do an ICF level of care. Which assessment that an individual receives is based on their age. We have 2 NRI assessments that we're using. This was one of the changes that happened July 1 was to move to the NRI. And that level of care for the ICF is going to look at self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living. And based on that level of care is then going to say which waivers an individual is eligible for. Because we have really a children's waiver, the family support waiver, and an adult waiver, the DD80 waiver. If an individual meets the level of care, that would be the first determination. Are they going to the child, or are they going to day? And then the next question would be, or are they triggering and need the level of services and supports that only the comp waiver can do? And so if an individual is an adult but needs more intensive services, that would trigger the comp waiver. If an individual is younger, and would normally be going to the family support waiver, but triggers the comp waiver, then that would be how an individual moves into the comp waiver. But it's just going to be that general DD application, and then that level of care is going to help get us to the right waiver based on a participant's need. Looking at services, there are many services very similar across the waivers, but focused based on age parameters as well as need parameters. Day services, focus on integrated competitive employment, providing those hours during the day to teach and support skills. We also then have the residential services, and those can occur one of 3 places, either in the participant's home or family home, and then at a provider operated home. So our family support waiver is designed for those individuals who would normally be able to access many services through the local school district, and is designed to support the family, so it doesn't have those intensive residential supports in it. Our day waiver is designed to replace the school-based supports, and so we see the addition of some of the vocational services as opposed to the family support waiver that would assume an individual's accessing those vocational services from their school district. And then we have the comp waiver, which takes the day services available with the DD80 waiver and then adds those continuous residential services as opposed to the day waiver that supports the more intermittent residential services. Again, there's a DD waiver quick guide so that you can look at all the different services and see kind of specific descriptions of what all of those services that are available on the DD waiver side are. So how does the process work? Applying, eligibility, service coordination. The easiest and best way to apply for one of our waivers is online through iServe. As I mentioned before, this is newly launched. It replaces Access Nebraska and is a much stronger system. This will allow an individual to apply for everything from Medicaid to waiver, or for only Medicaid or only waiver. And we'll walk a person all the way through that process. When you apply to iServe, you can apply for, as I mentioned, both Medicaid and the waivers in one application. So there's the healthcare application. Here's also an example of the HCBS AD, TBI, DD, AD. That would be the other side of the application that you may need to apply for if you already have Medicaid. The eligibility process will verify an individual's Medicaid status, including disability. We'll verify a TBI diagnosis if that's necessary, or verify developmental disability, looking at a diagnosis and those limitations that we had talked about, and ensure that all of the other waiver requirements are met, including that level of care assessment. We do schedule to call an in-person NRI, and an applicant must meet the level of care in order to be served by our waivers. Once a person meets all of the eligibility requirements for Medicaid and the waiver, they're referred to a service coordinator, and a service coordinator is then assigned to meet with them. The service coordinator reaches out to discuss needs. The waiver services are determined and a consent is signed. They'll discuss with what services are appropriate, what providers might be appropriate. And after the person-centered plan is written, services can begin. Jill, do you want to talk a little bit more about SC?
Yeah, I'd be happy to. So we want to make sure that we are assigning a service coordinator throughout the state where you live in your local community. So service coordination is going to be assigned that way. For our DD waiver, we have all of our service coordinators are teammates of DHHS in our Division of Developmental Disabilities. For the aged and disabled waiver, service coordination is service coordination is provided by a couple different entities. So if the kiddos are birth to 3, typically they're involved in those EDN services, so that early development network, and they would be providing service coordination there. For little kiddos who are ages 3 to 17, our internal DHHS service coordination teammates provide service coordination for that age group. And then at the age of 18 and older, the League of Human Dignity could be a service coordinator, or the area agencies on aging, or the AAAs, also provide service coordination. The traumatic brain injury waiver, service coordination is provided by the League of Human Dignities or the AAAs. It just depends on which the family has chosen. So service coordination wears many hats. We have quite a lot of roles. And one of the biggest ones would be really making sure that they are that lifeline between services and the waivers and the system and the family, and what the family and the participants need. So we're going to be there to support and answer questions, and be able to provide you with updates as you need them. We will help plan what services the person needs, and we'll also help connect you with a provider in your local area. We are going to make sure that we're doing our very best to accommodate what the person does want, as long as it is within our waiver options or the service definitions. Service coordination, and especially now that we've rolled out the family support waiver, we have the opportunity to be a part of our IEP, or the IEP meetings with the schools. And so if the guardian or the parent does let the school know and invite us, we can be there at the table earlier on and help navigate some of those conversations about what can take place once their loved one is done in the education system and wants to move into long-term services and support. So having us there at the table can often help. And then, of course, we write and facilitate that person-centered plan at that yearly meeting. And then we're responsible, service coordination is responsible for those authorizations and monitoring what services were agreed upon to meet the person's needs, and then define and in the person-centered plan. So the person-centered plan, one of the things that service coordination uses, we utilize Charting the Life course tools. We're excited to be able to use this framework to help develop or inform the person-centered plan and help create a good life for a person. We want to make sure that services help the person be as independent as possible, but also be able to be as active in their community as they can. Service coordination does utilize 3 of the different tools for charting the life course. We utilize either the support star, the life trajectory, the life domains. And again, those are one of the tools that either your service coordinator on the AD waiver or the DD waiver is completing to help inform that plan. In the plan, we want to make sure that we're documenting all the life that the person would like, and we're going to identify services, supports, resources, natural supports we're defining in this plan, just everything to kind of complete that full picture for the person. It is required that a person-centered plan is completed and it's approved before waiver services. This is often comes up where providers will want to just jump right in and start services, but we can't. We have to make sure that there's a person-centered plan approved and ready to go before services can start. The person-centered plan is a living document. It can be updated as often as needed. And so anytime there are changes, significant changes for a person, we'll want to make sure to go ahead and change that in the plan. And of course, anytime there's changes in services, we would want to make sure to update that as well. Again, this slide is just a little bit about the life course framework that service coordination utilizes to help develop that person-centered plan. Really giving us the opportunity to focus on what that person wants, what's important to them, and then making sure that we're also capturing what is needed for that person and what's important for them. This last slide is, again, a slide of our public website. There is a whole host of information on our public website. It should be kind of a one-stop shop for information. I've been with the department for over 20-something years here, and we have come a long way in the information that is available on our public website. But if you want to go here, right here is listed on that main page for where to apply. You can also use that QR code, and that will take you to the application for iServe page as well. There's also a lot of resources on there, and you saw that was circled. Sorry, Colin. And if you go there, a lot of the presentation or information that we're sharing, some further definitions of some of the services, there's just lots of information that might be helpful for families as well. All right, I'm going to go ahead and kick it over to Colin.
Would we maybe pause for a couple of questions here? Would now be a good time?
Sure,
okay.
That sounds great.
If a person is in a crisis situation and may need a waiver application prioritized, is there a specific process to seek that assistance in a crisis situation?
So I would say if the person or the family has filled out the application and they have been in contact with an eligibility and enrollment worker or a waiver service specialist, I would make sure to share with them the situation that they're in and see what they can do to go ahead and prioritize that and to get it moved up to be completed more quickly. If an eligibility and enrollment worker hasn't yet been assigned, my recommendation would be that you just try to reach out to the division with our 800 number or one of our mailboxes and just share your information, and we can see if we can maybe review it and look to see if we can move that to be able to complete it more quickly.
Okay, and you may have covered this with your website, but is there a place where you can locate the waivers and what they cover, what services are on each waiver?
So that's
Yes.
available in the quick guides that'll be sent out. It's also, if you click on one of our waiver programs, so you see here on the Learn More by HCBS programs, the AD, the DD, the TBI, clicking on those will take you to service guides and service summaries for all of those waivers. So not only can you see and compare, we have some resources that allow you to better compare which services are available where. We have other more in-depth guides if you're particularly interested in what exactly is supported family living, or what is this supported employment service actually mean. We have extended guides that are available, organized by waiver there as well.
Okay, if you're currently on the AD waiver, do you have to apply for the CDD waiver, the comp waiver on iServe, or can that be done through your services coordinator?
So within the Division of Developmental Disabilities, we have 3 different DD waivers. So if you've already been statutorily defined and met the statutory requirements for DD eligibility, NRI will drive a different waiver. If you're on the aged and disabled waiver, you would need to complete an application for DD in order for that to be able to be looked at. And so when you asked the question, I heard you say AD, but sometimes people get confused and they think the DD adult day waiver, and sometimes it's the AD waiver. So I wasn't sure which way the person was asking.
Let me see. For those families that may not have access to a computer, or know how to do an application online, are there paper forms, or what are the options for that?
Yeah, there are paper forms. We have paper forms available in English as well as many other languages. And so hopefully there is a paper application in whichever language is going to be most useful for the particular family. Those can be printed off of our website. The paper forms are there. Download the PDF, print it off at home or at the library. They can also, though, call. You see that toll-free number there on the phone, the 877-667-6266. That's our DD main line, and they can call and talk to one of our friendly folks that answers that number and request that an application be sent to them. And if it needs to be in a particular language, they can let them know that as well. And we will send them out an application that they can either fax back to us, they can mail back to us, or email back to us, or drop off at a local office if that's going to be easiest for them.
Okay, we have a question here. I was told that my daughter, who is currently on the A&D waiver, would not be approved for the comp waiver, even though it's listed as being for people of all ages. I was told I would keep being offered the family support waiver until she ages out of school, but the family support waiver would be a huge cut in benefits.
Yeah, if they're currently so I apologize if any misinformation was shared, but every year at that annual time, that the annual level of care for the DD waiver, so if they're on a family support waiver FSW, the DDAD, the DD adult day waiver, if they're on one of those waivers, it could perhaps trigger the comprehensive waiver. If they're currently on the aged and disabled waiver, it won't trigger one of the DD waivers unless they apply for DD services. But each year that level of care, that NRI will be completed. And again, based on the situation for the person, the needs that they have, it could very well trigger a different waiver to be able to support their needs. This is a newer process, right? We rolled this out July 1st, so we're certainly doing our best to level set with everyone and make sure they have all of the answers to help support your questions. So I certainly apologize if people are giving confusing or misinformation, and we'll do our best to make sure to circle back and kind of just remind folks the process.
Okay. And I do want to apologize. There's a lot going on in the chat, so I'm trying to keep up with the questions. So if I miss anybody's question, I really apologize. And please feel free to type it in there, copy and paste it in there again, and I will get it to them. Otherwise, I believe we are caught up on questions as of right now. If we're ready to go on to the new and exciting changes that are in store for all of us in the waiver world.
So this will be my wheelhouse. So this is the part that I'm most excited about presenting on, which are the new waiver services that we have available on our waivers as of July 1. The July 2025 AD and DD waiver amendments do include new services. To offer these services, providers are going to need to add themselves in Maximus because these are new services. So if you're already working with a provider, they may need to work with either Shauna Adams, our provider relations manager, if they're a DD waiver provider, or their resource developer at the local AAA or league office to get these services added to their profile so that they can offer them. But these are the new services that are available. We had for our DD waivers, we added more services than we did for our AD waiver. Our AD waiver only added LRI personal care. we have a waiver renewal coming up for that AD waiver that we just started working on. That'll be live August of 2026. And so we will be looking at possibly adding services or changing services as part of that process. So we didn't add a lot to the AD waiver, but we did add the LRI personal care. We also unbundled, I'm actually kind of working reverse order here. We unbundled our residential habilitation services on our CDD waiver. Previously, we had a single residential habilitation service. And within that service, there were 3 different ways of receiving that service, either continuous or group home, host home, or shared living. In order to better support participants, we did unbundle those services and broke them out into the 3 respective services. And then in doing so, also added a youth continuous home, which is designed to support youth within a continuous home or group home setting, focused really on stabilization, and then ultimately supporting that child back into a more integrated setting. We also added remote supports and health maintenance monitoring. These are again designed to support a participant's independence, particularly in those if an individual is not using the continuous residential services where they're living either fully independently by not receiving any kind of residential support, so they're receiving independent living services, or they're living with their family and receiving that supported family living. Health maintenance monitoring and remote supports are 2 new services designed to really give them the tools and technology necessary to maintain their independence. We also added, based on the division's commitment to supported employment and supporting individuals to join their community through work, we added employment exploration and benefits counseling to our day and comp waiver, where the vocational services are available. So I'll now kind of go through and talk about these new services, and this time I'll work in order. Benefits counseling, this is a new service to promote participants' economic self-sufficiency by helping them to understand how their benefits can be used and how their benefits impact their eligibility for different programs. It's broken down into allow for education, planning, and management. And the way that the service is designed, it can be provided definitely to the participant, but can also include education and information sharing with other folks in that participant's life, be that a guardian or a loved one or any other person that is able to, and that the participant wishes to keep informed of their benefits eligibility. We understand sometimes that the participant is interested and excited to start that job, but maybe mom or dad or best friend is a little bit more hesitant as to what that new job might mean for their eligibility for waiver or any other benefits. And so the service is designed to support the education of the participant as well as that loved one. They're able to access this, get a report out from one of our trusted partners on how a future change in income or employment might impact their benefits. The next one is employment exploration. And I've been encouraging folks to think of this for those people who may be familiar with pre-voc service, the pre-vocational service as a pre-voc. We do recognize that there are individuals that have come out of the K-12 public school system, probably came out at 21, and immediately went into day services and have been that was the best choice for them at age 21 or age 22. But now they're 26, and day services are just not really where it's at anymore. And they're interested in something new, something different. They've heard about from their friends that whole job thing. And that sounds interesting, but they're not quite sure. Employment exploration is a great opportunity for them to decide, is competitive integrated employment really something that I'm interested in? This is a very time-limited service designed to be done within a month, only 40 hours, really an intensive program to understand, is competitive integrated employment something that I am interested in doing? Identifying their specific interests or aptitudes, learning more about opportunities by doing business tours or informational interviews or job shadows at potential employers to see what is a job really like. At that point, once I've identified, yeah, a job is something that I want, we would then help them to either say, okay, I either have the skills necessary to go straight to VR, and the team at VR or vocational rehabilitation can help me to find that job, or I still need to build some generalized job skills where maybe I might go into pre-voc and build some non-specific job skills before that VR referral. But employment exploration really designed to support an individual to understand, is employment and competitive integrated employment really going to be something that I want in my future, or maybe not. We also added remote supports and health maintenance monitoring. There's kind of 3 ways that these services can be used. The remote supports are designed to allow the use of new technologies to foster independence and avoid the need for more intensive supports. So the remote support service is available to those individuals who are either not receiving any kind of residential services or are receiving independent living or supported family living. We can then add on remote supports, working through the service coordinator to get that added, so that they are able to use new technologies to support their independence. We also have virtual supports within continuous residential settings. These virtual supports are the same kinds of technology, but because we're already providing for the continuous care of that individual through those continuous residential settings, either continuous or group home, host home, or shared living, there is not a new service that we're authorizing, but those services can use those virtual technologies to provide that same kind of support for a participant's independence, but doing it within that existing authorization. And then lastly, we have the health maintenance monitoring, similar to the remote supports, and allowing them to use new technologies, but really focused on health maintenance as the core goal of the service, as opposed to just participant independence. Next, we come to Youth Continuous Home. Youth Continuous Home is a continuous residential support for children and youth that's available to children and youth on the CDD waiver with specific needs and residential risk factors. It's designed to provide a specific service and setting that would be designed for children and for youth. We recognize that the best setting and the best provider for a 5 or 10 or 13-year-old may not be the best setting or provider for a 23, 43, or 63-year-old individual. Different needs and different kind of expectations, both from our side, from the participant side, from the family side, for those. And so the Youth Continuous Home is designed to be child specific. It's also designed as a short-term support for youth who are in crisis or experiencing significant challenges, with the ultimate goal of building the skills and abilities necessary to reintegrate the child in the family home. So it is designed to be a shorter in duration. It's not meant that a child goes into a youth continuous home and that's where they will always be. We're really want the service to build those needs so that the stay in that youth continuous home can be as short as possible before we're able to get that youth to the point where they can reintegrate within their family home. And lastly, we come to LRI personal care, which I think is why many of you are here tonight. LRI personal care was added to our 3 DD waivers as well as our AD waiver. LRI, so the first thing we needed to do here is define what LRI is. So in our waivers, we have 3 different classes of individuals that we look at when it comes to providers of services. And the first one, the broadest service or relationship definition, is that of a relative. And this is out to the 3rd degree of consanguinity. I'll let all of you Google that word. But the 3rd degree of relationship to an individual, including the foster parent, foster child, step parent, stepchild, adopted children. So a relative can generally provide most of our services. We do have some where relatives are limited, but almost all of our services can be provided by a relative. This is just an average, someone you might meet at the family reunion. There are specific definitions related to children who may be a member of one of the Native American nations, and those are defined separately in statute, and that reference is there. So first we have the people that you might meet at the family reunion. Those are our relatives. And then we have legal guardians. Legal guardians are those individuals who are appointed by the court to serve as a guardian for someone 19 years or older. Children do not have legal guardians. They don't. They have potentially LRIs. So legal guardians only applies to adults. We have updated to allow guardians to serve as providers under agencies on the DD services. So that's a change that we made. But those legal guardians are those people appointed by the court. Many times the court might appoint the parent of a child to be the legal guardian. At the point that the parent is appointed as a guardian, though, they fall under the legal guardian category and not the parent category anymore. So then legally responsible individuals are only, under Nebraska state law, the spouse of an individual or the natural or adoptive parents of minor children. Those are the only two people or classes of people under state law that are legally responsible individuals. Recognizing full well that legal guardian and legally responsible individuals seem like they would mean the exact same thing, but they aren't. Different rules for legal guardians versus legally responsible individuals. The LRI personal care service is designed only to be provided by legally responsible individuals, so it's only available to parents or parents of minor children or spouses. LRI personal care. So it's providing services in home or in the community to meet the exceptional care needs of an individual and is focused in on ADLs and IADLs. So what are those ADL needs for an individual to live in their home, and what are the IADL needs? And the service is designed to support just those two areas and be provided, again, by that LRI. LRI personal care services cannot exceed 40 hours per week. This is for the individual, not 40 hours for each of the different providers, because an individual could have multiple LRIs, especially youth. There may be mom and dad. There may be stepmom and stepdad. We are looking at the individual 40 hours a week, not each of those four parents having 40 hours. If an individual is assessed at more than 40 hours per week, only 40 hours will be authorized across all of the LRI providers. The way that we authorize service or identify the amount of need or the amount of authorization that we're able to provide is through the extraordinary care tool. The extraordinary care tool will be completed by the service coordinator initially and then annually thereafter. In order to qualify for LRI personal care, an individual will need to score score a yes in at least 3 or more tasks to qualify for LRI personal care. So they need to have at least 3 ADL or IADL needs where they need total 100% support in order to complete that ADL or IADL task. Only then the qualifying needs or categories from the tool will be included in the authorization calculation. So if an individual only has needs in the areas of toileting and bathing, those will be the only areas that we're able to authorize services for. We can't support the meal preparation needs if there's not a need identified in the tool. So an individual will need to score a yes in 3 or more areas to qualify as having extraordinary care needs, and then only those areas where an individual scores yes can be authorized for services and supports. as far as provider requirements go, in order to provide this care, we have to hold people to the same standard. That's one of CMS's core pieces, is when LRIs provide services, they have to be held to the exact same standard as any other provider that that provides waiver services. And this comes across in our expectations for agency providers. So in addition to meeting all of the general waiver provider requirements, the LRI must also be an LRI for the participant. We can only authorize the service to be conducted as in that kind of DSP role by either the parent of the minor child or the spouse. They have to use electronic visit verification. They have to have the skills skills necessary in order to access both the EVV system and THERAP, our state mandated case management system. And they also need to complete any agency required training. So if there's a training that's required by the agency, the parent or the spouse needs to complete that training before they can be authorized to provide the service. We have an expectation within that onboarding process that background checks are conducted and that they are the same background checks and the same standards as that we would do for any other agency provider or agency employee. The personal care providers must be approved through Maximus. They're going to need to come through our normal provider onboarding process. The LRIs need to be classified as W-2 employees, so the parents would be getting another W-2 if they are employed elsewhere, or their W-2 would need to come from that provider. Can't have contracting, must be W-2 employees. And then they have to complete all of the training and competency the same as any other employee of the agency. And so parents who are providing the service need to understand that they are going to be held to the same standards as all other agency providers. We recognize that different agencies have different standards, so they all have a core set of expectations that we've set for them. But an individual needs to know that if this is what the provider requires for all of their employees, it's going to be required of you as well. It's also important that incidents are reported. Those GERs are completed during the hours that services are being delivered. There's also an expectation that EVV is conducted start time, end time, location, making sure that we're collecting all of that necessary information, and that the monitoring process is similar to any of our other services, such as supported family living or community integration. That means that a parent or spouse will be providing that information that is being asked of them by the agency providers. The same way that if you as a parent have your child in another service, you would expect that agency to be doing their due diligence. The agency needs to treat this service just the same as they treat all of their other services and collect that same level of monitoring and documentation. We do have some links here. Again, when Jennifer sends this out, you'll be able to access them more easily. We have a service summary handbook for our AD waiver where it's available. We also have a service summary on our DD waiver. And then an HCBS resource that really looks at the three categories that I talked about: LRIs, guardians, and relatives, and which type of individual or class of individual can provide which of our waiver services. That's a really helpful guide to understanding what services are available by who and when. Want to get in here just a little bit more about hiring parents and legal guardians separate from LRIs. So before or when they are hiring them for LRI personal care, this is just kind of a little bit of reiteration. They're going to need to sign up to be that LRI personal care provider, and then know that that parent is approved to be the LRI, including all of the kind of onboarding that needs to happen. LRIs will then only be authorized to complete the ADLs and IADLs identified in the assessment, and they cannot provide other waiver services at the same time. We did also change our waivers to allow guardians on the DD side to provide services. This is a change. Previously, guardians were not allowed to provide services on our DD waiver. We did recognize that statute would technically allow them to provide services. And so in the interest of making sure that our participants are well supported by a strong workforce, we have opened up the services that we can and where appropriate to guardians to be able to serve as providers in that DSP role. I won't read the slide to you, but that is a change. And you can see that full listing on that resource that I shared just a minute ago. That's on the DD waivers. On the AD waiver, participants have long been able to have services delivered by a guardian. And so if an individual is seeking to become a provider for one of their wards, we would expect that they be related and that they work as agency employees. I should go back and say that is, I will go back and say. So when we opened it up to guardians being providers of waiver services on the DD side, the exception that we were able to make within the confines of the law was that those legal guardians needed to be related to their ward. So that's out to the third degree of consanguinity, related to their ward, and they may then provide those services when they are agency employees. And so important that guardians have that agency oversight, again, be treated the same as all other agency employees, and importantly, be related to their ward. We are then cross-applying that to our AD waiver for new incoming guardian providers. So if a guardian is not currently a provider for that ward, but are interested in doing so, we would expect going forward that they be related to their ward and that they provide services only as agency employees. If they are currently providing services, because it's been a longstanding practice that guardians were allowed to provide services on the AD waiver, they will not be impacted. But if they are new and newly interested in providing services, we will hold them to that expectation, both that they are a relative and that they are providing services as an agency employee. That is then the end of our presentation. Our contact information is here, but I'm sure Jennifer will have a whole host of questions for us before we conclude.
The number just keeps rolling up. So yes, I figured we wouldn't get it done early tonight, but I think I was right. Okay, so the first question, actually just maybe a clarifying question, on that 3-page resource guide on the LRIs, legally responsible individuals, legal guardians, that you can access on the website. It says on that same form on page 2 that it says the legal guardian can provide host homes on page 3, and then on page 3 it says it cannot. And then a previous question was when it says who can provide each, it says yes, that the legal guardian can provide community integration, and it doesn't have the agency connotation next to it.
Oh, no.
I will go in and tomorrow re-review that resource guide,
Okay.
and make sure that myself and my team are 100% on all of the things in that resource guide, just to make sure that it's accurate, and we'll get it updated if it's not. But the last time we reviewed it, we hadn't identified any issues, so thank you for bringing those to our attention.
Okay. So if you have a child turning 19 soon and still lives with both parents, I was previously told to have my husband be the guardian and I would be the provider. Is this not accurate anymore?
So as of July 1, it doesn't matter who is the guardian and who is the provider. The guardian is able to be provider in this situation because you're related. You are a parent, you are an LRI for 19 blessed years, and now for the rest of your life, you have the opportunity to be the guardian, if that's appropriate, and you will be able to, because you are related to that participant, then you can provide services as a guardian. So that is. It was probably good information that was given to you when it was given to you, but it has been a change since July 1, and that was the opening up of the provider pool that we were able to do. So because you're related to that, you're related to your ward, you're the ward's parent, you are able to provide services while still being their guardian. So now, instead of just having one potential provider, you can have two potential providers.
And I would just add that, go and take a look at what services. So it doesn't mean all and every service on the DD waiver would a legal guardian be able to be a provider. So that is something important to note as well.
Okay. I have a question. If parents are co-guardians, can one still be the LRI provider? How does the LRI personal care program overlap with shared living provider?
So a guardian can never be an LRI for the same person. I'll start by saying that. You would be a legally responsible individual for that child until they turn 19, at which point you may be appointed by the court to be their guardian. But you would never be an LRI for the same individual that you were a guardian for, because guardian is limited to only adults, and LRI, when you're thinking about the parental role, is only available for children. So you're either in one category or the other. As an LRI, you're only able to provide the LRI personal care service. You're not able to provide any other service, including shared living for that individual. For shared living, I will have to look that one up and see
Shared
if it
living.
has.
Yeah, it's not, if you are a legal
Thank you.
guardian, you're not able to be the shared living provider, correct?
Okay, and then there was a question on if the department has any guidance to agencies on the W-2 employment status and the time waiting. Do you,
So
for the LRI?
anything, when it comes to employment or taxes, we would encourage those. And we were just in a provider call. I believe it was our third quarter provider call that Jill and I were both on just the other week. And our guidance to agencies was that they needed to consult their tax people to understand what their obligations were. We can't provide tax advice to those providers, aside to say that they need to be classifying those LRI and guardians as W-2 employees.
Okay. Can a comp waiver individual qualify for both the LRI personal care and shared living provider services?
No, not generally, because that shared living should be used by, generally speaking, is designed as an adult service. The LRI personal care designed as a youth service for most cases, unless there's a spousal relationship there. But we wouldn't see, likely wouldn't see a shared living provider married to their participant. So there's no LRI relationship there. And if an individual is in an SLP, there's not really an exceptional care need there for the parent, because the SLP is addressing that care need.
And I'm muted. Sorry, I'm just trying to get to the questions. and I'm answering some and oh, did I get caught up? Okay, probably not. So because I know that I missed one in here, please type it in the chat again, because I'm sure that I missed one and I apologize. We did get a thank you for getting that document reviewed on the agency question. Okay. How do we access the new services? At the annual review or through services coordinator?
Both times. You'll be able to, Jill unmuted herself, so she'll have a better answer, but talking to your SC anytime is great.
That was a beautiful answer, Colin.
Okay. And then as far as the legally responsible individual services, will the child need to be reevaluated for those services?
Yes, that LRI person or that LRI extraordinary care tool, it's the DD26, will be completed initially when the participant is first being kind of considered for LRI personal care, and then will occur annually thereafter the participant's annual ISP or in advance of the individual's annual ISP meeting.
If the individual is on a Nebraska waiver and moves to another state, does the waiver follow?
We require that an individual, part of Medicaid eligibility, which is what all of our waivers are tied to, requires the individual to be a resident of the state of Nebraska. So if that individual establishes residency in another state, they would no longer be eligible for Nebraska Medicaid, which means they would no longer be eligible for one of the Nebraska HCBS waivers.
Okay. So a clarifying question. The LRI personal care, currently co-guardians for a 19-year-old, no shared living provider services yet, since can't be co-guardians. Does 19-year-old qualify for LRI personal care provided by the guardian?
No, because they have reached the age of majority. And so they, until they marry, they will not have an LRI in their lives in order to provide that service.
Okay. As far as eligibility time frame, when applying for the DD waivers and Medicaid, is the eligible from application to getting approved still 6 months? Do they get approved for Medicaid first or for DD first? Does that make sense?
Jill, I would defer to you on timeline, apart from saying it's very much going to depend on the information that we receive, when we receive that information, and how complete that information is.
Yeah, our eligibility and enrollment unit, you know, and Colin's correct. Although I don't oversee that unit, we do work hand in hand with our eligibility and enrollment teammates. The more thorough documentation you can provide, the additional documentation you can provide, the faster it will be. But like all great things, rolling out something new, we are probably not moving as quickly as we would like through our NRI process July 1st. And so that has created a bit of a kink in kind of the normal process, because that unit has now added on all 6,000 DD waiver participants to an annual renewal. And so they're experiencing just some shifts in work. And so I'm not sure what the standard time frame is that they give. I guess I would just like to add to support them that it is taking just a little bit longer to get that initial eligibility completed. But once that is completed, I would, then they come over if they're eligible to service coordination. As far as which one would be needed to be done first, Medicaid or the DD or AD waiver, I would say it's probably good to apply for both at the same time. Just get it started in our Medicaid system, and I'd serve, as Colin had shared earlier, indicate on there you're also applying for an HCBS waiver. If you don't have that Social Security disability determination, or if you don't meet Medicaid standards under another category, they'll just kind of hold it until then the decision is made for either AD or DD waiver.
Okay, let's see. Can LRIs work shifts, or is it true that they have to clock in and out for each task?
They need to be, they can only provide the authorized services within that authorization. So and the amount of service authorization should be related to the services and supports that are needed, those ADL and IADL services and supports. And so an individual should be using the provider, in this case, the individual, should be clocking in and out using EVV when they are providing the services that they're authorized to provide, and clocking out when they're no longer providing those services.
And we have seen some families decide to clump some of those things together, being able to complete some of those tasks, back to back. So then that way it provides a little less times that the parent is having to clock in and clock out and utilize EVV. That is something, again, it just depends upon your kiddo's needs and maybe when you normally would do some of those tasks. But that is something that we've seen some parents do to make it a little bit easier.
Okay, my question is for the AD waiver. My son and EVV, my son's agency said once there's been 3 errors, his staff will not be paid as they will not be reimbursed. My question is, when does the 3 strikes restart, or will my staff just not ever get paid after the 3 errors?
So the EVV specific questions, I would defer to our Medicaid team. They're the ones who oversee our EVV process. And before Jill and I get this sent over to Jen to send out to all of you, we can include a bonus slide that would include the EVV email address, so you have a place to send those questions to. But I would also say that it is not it is not a 3 strikes and you're out. It is that the Medicaid program allows providers some leniency to correct 3 errors before they need to go through the full appeals process to correct additional errors. So if a provider believes that they completed a service and there was a legitimate issue that they are willing to send in an appeal for, they can still be paid. It's not that they would be continue to be providing services and not be paid. It's only that they can go and correct 3 errors before they would need to go through that appeals process, and would need to be adjudicated within the rules of the appeals process for any further errors.
Okay, we just had one more come in. So just clarifying, the legally responsible individual is a parent or an adoptive parent of only minor children.
Yes, so legally responsible individuals are only the spouse or the natural or adoptive parents of minor children. Those are the only individuals in the state of Nebraska that are considered legally responsible. Is the person that they are married to. You're responsible for that person, and you're responsible for your natural and adoptive children who are minors. So when they turn 19, you may then become their guardian, but then you are no longer their legally responsible individual.
I think I spoke too soon. Can relatives provide services as independent providers?
Yes.
Okay. I think that is the last question that I have in my queue, except for all the ones that I missed. So I apologize. Again, if there's more, feel free to send them. Or if there's questions that you guys think of later, you can always email me or Chrissy and we can forward them on to Colin or Jillian. Or you can ask them yourselves, I guess. There's their contact information. Skip the middleman.
Well, again, thank you first and foremost to Jennifer for organizing all of this and everybody at MMI for hosting it. And thank you to everyone here attending for coming out to learn more. We hope that this really improved your knowledge and understanding. I know it was Jill and I's pleasure to be here.